Bolominaka, ladies and gentlemen. I hope everyone has had a blessed Mother's Day so far. Today we honor one of the most important person in our lives, from our birth mothers to our grandmothers, aunties, sisters, godmothers, foster mothers, nannies, and teachers. It is for this reason that I want to raise an issue of supreme importance to the health of our people, our moms included. I've wondered whether this topic was a bit too heavy for a day like today. However, I think right now is the right time to raise the alarm on the most pressing health crisis facing Fiji today. I'm speaking of non-communicable diseases. Whilst the worst of the COVID-19 pandemic is behind us due to the government's nationwide vaccination campaign, this other silent epidemic has been worsening for decades. NCDs are diseases like heart disease, diabetes, cerebrovascular diseases, hypertension, cancers, chronic lower respiratory disease, kidney disease, and mental health illness. Most of us know these diseases as well because the terrible truth is that every person in Fiji watching me right now either suffers from one or more of these diseases or they know someone who does. These conditions are causing thousands of people to die before their time. In 2020, more than 6,600 deaths recorded in Fiji were attributed to NCDs. I now have access to newly released figures for 2021, and the situation is dire. More than 5,800 deaths last year were caused by an NCD. But don't be fooled by this slightly lower number. This was only the case because Fiji was in the middle of battling a global pandemic. While we don't technically list them as NCDs, NCDs were the contributing factor to many deaths caused by COVID-19. In a population of less than 1 million people, these numbers are staggering. I want to make it crystal clear. This situation is not normal. It is not okay. It is not sustainable. And we are heading towards a breaking point. NCDs like heart disease, diabetes, cancers, cerebrovascular disease, and respiratory disease, kidney and or renal diseases are all complex diseases that differ in very important ways. But they share risk factors. They are often caused by the overconsumption of foods that are high in cholesterol, fat, and salt, and by a lack of physical exercise. Smoking and high alcohol intake also aggravate these diseases. You don't have to be a doctor to see the pattern here. Our eating and our lifestyle habits are killing us. The message is not to place blame or evoke shame among anyone. On the contrary, what we want is to raise an alarm bell, a heartfelt plea to every single Fijian to pause and reflect on your life right now. Fundamentally, I want to stress that this is not a problem reserved for the older adults, not at all. This is what we call a crisis. We see young people in their 20s and 30s dying from heart attacks, strokes, experiencing kidney failure, and undergoing diabetic amputations. The list goes on. People are in the prime of their life and should be at a peak physical health, living and working, building a future for themselves, and instead they're fighting a daily battle just to survive. In a country where 62% of our population is below the age of 35, this is very, very worrying. NCDs are costly to our health and to our country. Sick people need medicines, hospital visits, major surgeries like amputation. All these places a serious burden on our society. We're talking millions and millions of dollars on top of the suffering that we see every year. Additionally, NCDs can create a vicious cycle within multiple generations of the same household because the dietary and the lifestyle habits are learned behavior. So the children learn from the same unhealthy behavior that we have as adults, and we pass it on to generations and generations. The cycle is so pervasive that many times people think that they have no control over their own health because this is how it always been in our family. What they don't realize is that reality is changeable. It is not fixed. We can focus on what we're feeding our bodies, how much we're exercising our bodies, and maintaining a healthy weight range. I guarantee your body will respond positively when you live more healthily. The most straightforward way to control these diseases is to focus on reducing the risk factors associated with him. Decreasing your intake of fatty, oily, fried foods, including eating large amounts of butter and ghee, red meat, fast food, foods that are high in salt, sugary drinks and foods, high carbohydrate and starchy foods, alcohol, smoking. I think it's critical for me to point out here, there are no safe levels of tobacco use. Every cigarette or suki is doing your body harm. Evidence shows that also early detection and timely treatment of ACDs by your family doctor, health center or hospital is an excellent way to get control over your health and reduce the need for more expensive treatment later. To support all Fijians to gain control over their health, the Fijian government continues to make high-quality healthcare available to our people by engaging with the right partners, including people in the private sector. We are expanding the free general practitioners program. Remember that through this program, Fijians can access healthcare, including all the blood tests related to diabetes, at a growing list of private GP clinics and private laboratories throughout Fiji. We continue to increase our efforts to improve diets through education and policy development, including controlling advertising to children, advertising of breast milk substitutes. We're also looking at adopting setting-based policies and implementing salt, sugar, and fat reduction strategies. But all these cannot work unless you, the people of Fiji I'm talking to, engage in this message. Book a consultation with one of the private GP clinics or visit your nearest health center to get a full checkup done. If you are living with an NCD currently, make sure you schedule your regular consultations with your doctor to ensure that you're managing your condition well and staying on top of your medication. Make a commitment now to clean up your diet. We need to eat more healthy foods, like the fresh vegetables and fruits that are behind me. These are found also abundantly in all our markets and can even be grown in our backyards. Organize a simple weekly exercise plan. This can be as easy as getting out at least 45 minutes of brisk walking every day. My fellow Fijians, we all know that life is precious. Let's act like it is. We need to be more resilient. That means we must be strong in this commitment to keep our people healthy and safe. Let's turn this NCD situation around now so that our children don't have to continue to carry the burden of sickness and premature death. Every young person should be able to look forward to a healthy, bright future, excited about the potential that lies before them. Once again, a blessed Mother's Day to you all. Minakawalewu and good night.